When you enter into the Vedic sciences, you just become a perpetual student.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
I'm doing pretty well. I've just been thinking and contemplating, with all these new things that have been coming out just recently, all these new emerging therapies.
Right.
What about the ones that have been around for thousands of years?
Oh, yes, my friend. Today we are in your wheelhouse. We're going to talk Ayurveda, but also this new concept I just learned about. I'm not surprised that this ancient philosophy and practice has so much to offer, but every time I learn something new. So I'm really curious to learn about this new practice that I've never heard about before. Let's bring some expert in, huh?
Yeah, I agree. And in fact, what we're going to be talking about today is Ayurveda, but it's also something that a lot of people might not realize. We've talked about a lot of different specialized points on the body, say with acupuncture, traditional Chinese medicine, but Ayurveda has got a very deep philosophy and actually knowledge and science around this. And the therapy is called Marma. So we're going to talk about Marma therapy, but even perhaps the more important thing is that we're speaking to an Ayurvedic practitioner, educator, and she specializes in Ayurvedic body therapies, including Marmani and Facials. And so we have today Seva Nibley. And Seva, we are super excited to have you on the podcast so we can talk about this with you.
Thank you, because this is a very beautiful ancient science that I'm really excited to share with you as well.
Well, maybe we can start with a little background on, because yes, we love to learn, but we love to learn about you first. And so, Seva, can you tell us a little bit about your journey into Ayurveda? How did you get there? And what got you so interested in, there's so much to talk about in Ayurveda, but maybe you can tell us what got you interested in Marma specifically?
Marma specifically has come into my wheelhouse basically throughout my whole Ayurvedic journey. It's been an exploration because I started with Ayurvedic exploration in the late 90s at the Chopra Center for Wellbeing when it was in a small area in San Diego. And I was trained in all the Ayurvedic therapies, and I knew that that was my dharma and how I was going to not only make my livelihood, but pursue a lifestyle was within the Ayurvedic traditions. And when you enter into the Vedic sciences, you just become a perpetual student. And there's so much to learn, and you could just take several lifetimes learning everything that the Vedic sciences can share, and all the ancient wisdom is there. So it's just been making a presence, within my studies throughout, the last 25 years. And as I began to specialize in Ayurvedic body therapies and, both clinical treatments and day spa treatments, when I learned Marma therapy, it kind of brings together and merges the energetic body with the physical body. And the physical body meaning all the organs, the connective tissues, the joints, the tendons, the whole physiology and biology of the body. So it's just been super fascinating for me because I have just this special affinity and inclination towards that dynamic that Marma gives between the physical and energetic bodies.
Well, I love that. I love listening to your journey. Also, just, how you've been inspired. Just for everyone listening, so Ayurveda is an ancient tradition. We've talked about it multiple times on the podcast, but just to remind everyone, it comes from India, and it is really based on this. Overall, the basic point is there's a sense of balance, and then there's ways that you can go out of balance. And our whole goal, kind of like what we try to do in a lot of medicine, is to get towards homeostasis and balance. But Ayurveda tends to be a little bit more, I would say, prospective about it. It's not early reaction. It's catching things even earlier than that, so you can find the imbalances at an earlier point. And we're talking about Marma, which is Marma, Marma. And so, Seva, can you give us a little background? What is Marma and what is its underlying science and approach?
Yeah, exactly what you said. Like Ayurveda is a holistic medical science based on prevention. Because how wise is that to prevent a disease or symptoms before it happens, instead of trying to heal from it after the fact. So this is just another tool that Ayurveda offers in that science, right, of prevention. So Marma is essentially a vital energy point, and it's located on specific areas of the body. And as the body is alive and pulsating with energy, there can be innumerable energy points within it and upon the surface, but we have, kind of honed it down to 117 specific Marmani. And these points are vital because they're infused with prana or chi, like this universal life force energy and consciousness. And they serve as a bridge connecting the body, mind, and the soul. So they are specifically located at anatomical sites where veins, arteries, tendons, bones, or joints intersect, making an energetic highway, so to speak, connecting the organs and tissues energetically to even the cellular level. So like fascia is the connective tissue that communicates between our body's organs and tissues, Marma is the energetic connector of this prana to be able to flow freely through these channels and strengthen every part of our being to the cellular level. But just like traffic, there can be stagnation. Like if you think of these highways, like in the physical world, right? Like
I love the fact that you're using traffic because all of us can relate. And in fact, people listening to this may be in traffic while they're listening.
Yeah, so that's what I was like. So an energetic highway, kind of like a physical highway when you're out there driving around in traffic and everything. So you could think of the channels in the body that Marma points connect with, just like an energetic highway. So if there is traffic and you're in traffic and you're in a stagnation kind of holding pattern. So just like that, Marmas can be congested or damaged or injured, and you can feel that in the body with your own hands,
This is, I think, the underpinning of Marma is that there's this deep belief that the Eastern sciences have figured this out, that we're not just the skin and the blood and the bones that we have, that there's this force that's going through us and kind of like what gives us all life. Can you tell us what is the difference between the philosophies of Marma, or maybe even you can talk about the similarities between Marma and acupuncture, or say acupressure? How are they similar or how are they different? Mm-hmm. Just because everybody's so familiar with acupuncture and acupressure, but maybe they haven't heard of Marma, but it'll help put it into context.
And it does sound a lot like meridians, right? It sounds very similar.
Yeah, and that's such a good question. And I love being able to help, differentiate between these systems. So with Marma, we have a acupressure point system. And these are 117 points that have been outlined in the body through these ancient Vedic texts, specifically the Sushruta. Then there's Chinese medicine. And you have to understand that according to Ayurveda, those of us who practice it, we believe that this medical science is the original medical science. It's the oldest medical system in the world. And it had influence over Chinese medicine and all the other holistic medical systems. So that's what we believe. We believe it's the 7,000 years old since the beginning of time and had influence over TCM, right? So, but Chinese people have their own culture. And so they came up with a system that was in alignment with their geographical location, with the herbs that they grew in their area, with medical systems of their own findings that they explored once they gained the knowledge of Ayurveda and the points. Because if you looked through Ayurvedic texts, you will see that acupuncture was actually done with Ayurvedic physicians way back in, before TCM was evolved, it was born. and that they used copper needles, and this was something that was practiced as well as surgeries. And there was texts, that could describe the way that they performed all these things. So there is a traditional Chinese medicinal system of points along the meridian channels in the physiology of our bodies. And that is a very valid system. It's just a different system. There are several acupuncture points that coincide with Marma points. And then when these points coincide, it's like extra magnified, the benefits and effects in those points. And there are just certain locations in the body where they do coincide. So when you talk about acupressure is just simply finding the points that you can apply pressure to bring about certain effects. Then there's different techniques to stimulate these points. Acupuncture uses needling, but they also use moxibustion and even gua sha tools to stimulate and activate these points. And then there's just simply pressure with the fingers. And when we're using our fingers, then there's different ways that we can apply that pressure according to your constitution, according to the imbalances that are expressing, and according to kind of what the dynamic between the therapist and the client is happening there. And just an intuitive type of energetic dynamic, because Marma is an energetic points.
Amazing. Thank you, Seva. I think it really helps a lot of us, especially someone like me who's not really familiar, to really wrap my head around what Marma is. And I think I'm getting it now. And so now I'm curious, can you tell me how is that actually leveraged in practice? For example, maybe you can give us an example how you could use that in self-care, for example.
Yeah, it actually plays out very well in self-care because these points are accessible with just using your own fingers. And there's protocols, and different techniques we can use, like with the gua sha, with a jade roller, with a kanza wand, which I'm very fond of because, an Ayurvedic tool. So there's these different tools that we can use, especially on our face. And I like to highlight the Marma points specifically above the face because there's actually, out of those 117 Marma points, 1/3 of them, so about 37 points on the face, and face, head, and neck. That's significant. When 1/3 of all those Marma points are above the clavicle, and that's just like 1/8 of your whole body surface area, then you can really do a lot to enhance the body's healing and self-regulating system by just working with the Marma points above the clavicle.
Yeah, it sounds rather a dense area of a lot of energy intersection points. All right. And so when someone comes to you to have a session, what can they expect as they go through this?
And maybe you can also talk about how do you assess them and decide which points you're going to focus on?
There's different protocols depending on what the client is presenting with. They would do a symptomatic type of intake where if you are an Ayurvedic practitioner, then there would be a Ayurvedic intake where you would actually try to help assess the client's constitution, because there is certain ways to treat people based on their constitution. And there's certain ways to stimulate the Marma points based on your constitution. But if you are trying to incorporate this treatment as someone who's not an Ayurvedic background, then you would basically just go off of their symptoms. Mostly people might say, insomnia, anxiety, depression, these are the epidemic of the day, and digestion issues, which if you are having issues in all those areas, then those can manifest on your skin. You can see things on your skin that come through, like maybe eczema or psoriasis, hives, acne, any kind of like expression on this level of the skin, you can kind of see what imbalance is going on in the body. So depending on the imbalance is what kind of protocol you would design in that circumstance. So I don't know how to give you like a black and white answer with that, because with Ayurveda, there's so many variables, because the famous answer is like, it depends,
I love it.
it depends.
No, it's true. It does depend. But maybe you can take us through some of pick someone that has, I'll give you an example, because, you probably do a lot of treatments on the face. So if they have, say, inflammatory acne that's really being driven by maybe their hormones, and they're eating a lot of things that tend to be very oily or heavy, very amongst the doshas, very kapha heavy and maybe pitta imbalance. How would you approach that? Not to put you in a box, but just kind of generally, how would you approach someone that has a lot of inflammation and oiliness on the skin?
Okay, so that's going to be somebody that has a particular constitution. And not just constitution, but in Ayurveda, there's your original constitution that you're born with, and then there's a constitution that is your imbalanced state.
Right.
When you're working with people, you always want to address their imbalanced state and bring them back to their constitution that they were born with, which is called Prakriti. And that is going to be what is the alignment, the best optimal health for them, is when you can bring them back into their Prakriti. Yes, Marma is one way that we can help somebody come back to that. So when people are presenting with those symptoms that you described, I would see that they would need a lot of lymphatic drainage. They would need some help clearing pranic channels into the mind, into the energetic field of not just the mind, but the kind of like the programming of energy that goes on in their thoughts and patterns, helping them to make better choices, clearing the clutter of thoughts to give them better understanding of, maybe the consequences of their choices of what they eat, choices that really go against their inner intelligence. Right? And Ayurveda would actually say that's the biggest reason people experience imbalance, is because they make choices against their inner intelligence. Like they know the right thing to do, but they go against that choice. Like they know that they shouldn't eat the foods that might be causing those symptoms, but because they're in a pattern, they're in a imbalanced state that makes them crave those things. Because in Ayurveda, there's that philosophy of like attracts like. And so that when we're in an imbalanced state, we are going to have stronger tendencies towards the things that keep us imbalanced.
I love that you're bringing in the fact that there's a psychology around this whole thing and our tendencies. Mm-hmm. And then going back to the practice of looking at Marma and then actually performing a therapy, are there things that you take into account or maybe are careful with when you're stimulating the points? And then the secondary question is, how do you do that? Do you use any tools or do you use your hands? What is the approach?
Yeah, I do think there's a lot of beneficial tools that we can use to help someone, especially with the symptoms you were bringing up. When somebody has a lot of irritation on their skin, either in the form of acne or eczema or psoriasis, there's a really amazing tool that Ayurveda has taught us about, which is called Garshana gloves. And these gloves are simply raw silk fiber that you can just put onto your hand like a very nice fit glove. And they come in different shapes and sizes, but I like the ones that it's sewn in a pattern so that your index finger kind of comes apart from the rest of your fingers, so you can use it around the nose and the eyes and get more thorough with your treatment. And what's beautiful about these gloves and the raw silk is that there's a protein within this raw silk that's called sericin. And sericin is a protein that's very healing to the skin. So it's very safe actually on skin that has these irritations such as an inflammation such as the acne, eczema, and psoriasis. Raw silk is very soft, but as an exfoliation treatment is very effective. For two reasons. One, because of the sericin and how safe it is to use on skin that's inflamed with those things. But also, when you apply Garshana, you're doing kind of a quick movement over the surface of the skin, which creates a subtle electricity. And this electricity creates an ozone effect on the blood and the skin-associated lymphatic tissue, which is called SALT. So that's the acronym for it. And it's just under the layer of the tissue of the skin-associated lymphatic tissue, and it gets stimulated and moved. It moves and grooves with this Garshana technique, which ozone effect, was a huge trend, back in the beginning of the century, where ozone effect on the blood created alkalization, so an oxygenization effect into the blood. And when you bring oxygen into the blood and alkalization, then you have healthier blood, and therefore you have a healthier glow on your skin, and your salt tissues function better. So that's one tool I really like to use on my clients on their skin before a facial treatment or a massage therapy treatment. Also, by default, using these gloves and massage, it stimulates the Marma points. And then after we've done this stimulation, then we can actually deliberately go in and use acupressure on these points. And I like to do that with my fingers, but I also like to do that with other tools.
One of the things that I wanted to maybe just end on, because, Seva is going to be speaking at the Integrative Dermatology Symposium pre-conference. So for any of you that are dermatologists thinking about doing the Integrative Dermatology Certificate program, take a look, because you get some in-depth, hands-on experiences, and Seva is going to be there to help us with that. Seva, if you can talk a little bit about what happens with Marma, and then there's this device known as the Kansa wand. And can you just talk us through how that's used, and how is a facial or a therapy session with you different than, say, just going to a regular facial? How is it going to be a different experience?
Yeah, so I am familiar with a lot of techniques that estheticians use to massage the faces of their clients. And they're all amazing, and they all help drain the lymphatic system. And whether they know it or not, they are stimulating these Marma points. When you want to actually deliberately go in then after this massage and stimulate the Marma points, not only are you helping that lymph drain, not only are you providing a very harmonizing effect to both the sympathetic and parasympathetic nervous system, you're restoring prana to be able to flow freely through these energetic channels. And this goes directly to the nervous system. So not only are you targeting the lymphatic system, you're targeting the nervous system. And people, whether they know what you're doing or not, they're going to feel this effect. They're going to feel the effects of stress lifted. They're going to feel grounded. They're going to feel pampered. They're going to feel cared for. And they're going to feel their minds clearing and their energy clearing in such a way that they feel like a reboot or a reset into their nervous system. And they're going to see it on their face. They're going to have this amazing glow, and their skin's going to look beautiful, and they're going to want more of that. So the beautiful thing too about Marma points is they have a therapeutic effect locally, but as well as distally from that point. So even though you might be pressing points along nerve pathways in the face, this is directly going to the brain, and it might be going to other different organs of the body, right? So this can bring improved functioning of organ systems. It stimulates and regenerates tissues. It relieves energy blockages physically and mentally. We're flushing toxins. We're preventing aging. We're improving lymph flow. And, I can go on and on and on. But when you then, after stimulating the Garshana, exfoliation, and then we do a nice massage, and then we do this acupressure on the points. When we close this treatment with using the Kansa wand, this is really amazing because Kansa is an alloy metal of tin and copper, which makes a pure bronze. And this actually balances the skin's pH levels. So that's really important, and just this metal alone making contact with the skin can really bring a nice balance in that pH. So through a targeted application to the Marma points on the face, the Kansa wand alleviates everything I just said. It just brings about all those amazing benefits for stress reduction, muscle relaxation, improved energy flow. But because of this metal alloy together, it just activates the Marma points as well. So there's just a simple protocol, sequence going over the face with this Kanzawan, much like a jade roller you would do, but it's got a little bit of a different build. So we would just use it a little differently, and we would just focus on each Marma point as we go over it.
That's fantastic, Seva. Thanks for taking us through that. And I was just going to ask you about the science of tin, because I wanted to see if you could talk a bit about that, but you went right to it. So I love it. And I want to point out to everybody that's listening, in 2023, in the July-August issue in the Journal of Ayurveda and Integrative Medicine, there was a nice publication looking at a comparative study on Marma and acupoints. And Seva, you so nicely described how the familiar was acupressure, acupuncture, but now you're taking us to something that's, maybe new to people, but not really new to the science of the body. And so for people that have not heard about Marma, well, you can't use that excuse anymore because you've heard about it now. And you should explore this. It really is based on this energy science aspect. And I think the other thing that I take away from listening to you, Seva, the treatment's not just at the point. It's understanding a person's tendency, maybe talking through what their behavior patterns are, their lifestyle choices, their diet patterns, the way they think, the way they might even focus on different thoughts. It really is a holistic approach in the end, isn't it? When you're seeing these patients. So if maybe, we'd like to wrap up, but maybe you can just give us, what is your takeaway on this as being a holistic therapy? Just give us your overall take for why you think this is, what should I say, traditional yet revolutionary.
Yeah, I really believe that there are such a diverse range of modalities out there. But when you're working with people and their skin, then you want to maybe evolve as a holistic practitioner. And that could include nutrition coaching. And, people will have skin issues and they'll think it's just solutions of a topical nature, but really it does involve what they're actually putting into their body and onto their body, right? Because within 2 hours, skin being the biggest assimilation organ and elimination organ that we have, anything you put onto your skin, your head, shampoos, things that we put onto our head and face, which is mostly where people apply topical products. This comes into your bloodstream and your lymphatic system within 2 hours. So understanding that what you put into your body has just as much as effect as what you put onto your body, then you might want to make more holistic choices. So us as therapists and practitioners and estheticians, we would want to maybe incorporate holistic modalities such as nutrition, such as, holistic product lines that we can affiliate with so that we can be giving our clients the best resources in order to heal from the inside out.
Wow, I couldn't have said it much better than that. Seva, really appreciate your time on the podcast and taking us through what Marma is and also a little bit about Garshana. And thank you so much. And we look forward to seeing you at the symposium at our pre-conference.
Thank you. I'm excited to be there and to meet you all in person. Thank you for your time. I've enjoyed speaking with you.
And that's a wrap for today's episode. But these conversations are just way too good to end here. Wouldn't you agree, Raja?
Absolutely, Hadar. That's one of the main reasons I get so excited about our conference, the Integrative Dermatology Symposium. Every year, it's a chance for us to continue expanding our minds for what's possible in dermatology for our patients, and also to bring the latest clinical knowledge back to the clinic. And this year's theme has been long awaited. Do you want to spill the beans?
Oh, yes. You don't want to miss this one, folks. This year's theme is Nurturing Skin Resilience, the Science of Aging and Wellness. And it's happening from September 26th to the 29th, 2024.
Yes, and we'll cover topics from conventional medicine to traditional approaches, from inflammaging to exosomes, and from cosmeceuticals to women's health, and more.
The agenda lineup looks amazing. Not only the topics, but also the real-world case discussions, workshops, and networking events. No wonder we've expanded the IDS to 4 days. So much more to learn and do.
Plus, you can't go wrong at a brand new resort that just opened up this year at the Lowe's Arlington Hotel and Convention Center in Arlington, Texas.
Texas, here we come! And for our esthetician colleagues, please join us on Sunday for the Integrative Aesthetics track.
So come check out integrativedermatologysymposium.com for all the details. We hope to see you there.